Hi friends, thank you so much for tuning in to our very special Facebook Live session here at the Foundation Fighting Blindness. My name is Dr. Mary Sunderland and I am the Director of Research and Education here at the Foundation Fighting Blindness. Now, before I jump into things and before I say too much, I just want to say a hello to everybody who's there. And in the past, sometimes people have challenges with the volume and the sound isn't quite right. So can you give me a thumbs up or a hi in the comment section and let us know how the volume is. And I would also like to introduce a very special guest that we have joining us today, and that is Dr. Jill Dolgen, who is the Head of Patient Advocacy at AGTC, which is a gene therapy company. And because we're going to be talking about gene therapies today, it's so fortunate that Jill can join us. So you may say, like, where is Jill? She's not beside you, but Jill's actually joining us remotely. She's online and she'll be tuning in. Jill, if you're there, maybe you can type hello in the comments. And if there are questions that I'm not able to answer and questions we want to direct to Jill, she'll be there. And she can also relay questions to her colleagues at AGTC. So we're so thankful, Jill, that you're with us today. I am going to be talking about stories from our March e-news. So that went out a few weeks ago, and we decided to do the session a little bit later after March break. And I'm really glad we did, because it was a very exciting week in vision research. We had a really exciting story that we put up on our website earlier this week. That story is titled "Experimental Stem Cell Treatment for Macular Degeneration Restores Vision." So I am thrilled to be able to talk about that story a little bit today. But before I jump into that story, which is getting a lot of excitement around the world, we're going to talk about the lead story from our March e-news, which was titled "Gene Therapies for Blinding Eye Diseases, Clinical Updates and Access for Canadian Patients." So because we're talking about both gene therapy and stem cell therapy today, I thought it would be helpful to give just a really basic explanation about some of the differences between these two therapeutic approaches. So the first thing that you should know is that in general, people have been studying and working on gene therapies for quite a bit longer than stem cell therapies. The research dates back further, really as soon as we started to think about genes and the role that genes have in causing diseases. So I won't give you a whole history of gene therapy. I'll have to hold myself back because I'd love to do that. But what I will say is that sort of the unique approach of the gene therapeutics is that these approaches are targeting a mutation in your gene, a problem in your gene, a mistake that's causing your gene to kind of malfunction. It can't do what it needs to do. And so what a gene therapy does is it takes a functioning copy of the gene, one that works just fine, and it uses a viral vector, which is the scientific word for the vehicle that's used to introduce the gene into the cells where it is needed to do that work. And for people living with blinding eye diseases, those cells are in the eye. So when you think about gene therapies, you should think about introducing a gene to do the work it needs to do in your eye. And because these gene therapies usually are going to be given as a therapeutic after some vision loss has already occurred, the main end goal of many of these gene therapies is really to stop the progression of the disease. So if you have a problem in your genes, your eye, because of that problem, things haven't been working properly, the idea is if you could get a functioning copy back in, maybe you could restore everything, get it working properly, and stop that further progression. Makes it sound simple. It's a lot trickier. We've been working on it for a long time, and we're finally at this really exciting period where many of the very promising discoveries that were made in a laboratory setting funded by places like the Foundation Fighting Blindness here in Canada and other fighting blindness organizations around the world and government funders. Those discoveries are now moving into a clinical setting where we can test if they work on people who are living with the diseases. So that's the gene therapy approach. In contrast, a stem cell therapy approach, this is still a little bit newer, and the end goal of stem cell therapy, this is why it's so exciting, and we play the long game, because if we could get stem cell therapy to work, wow, it would be very, very cool, because the goal is that if, let's say your genes haven't been working, so your cells haven't been working, your cells have died. The idea with the stem cell therapy is that you could take some new cells and replace the old cells, thereby restoring vision. So it's really, gene therapy is introducing this new gene. With cell therapy, it's introducing cells to replace this damaged cells or damaged tissue. And stem cell therapeutics is still a little bit of a newer field. It was another big week in science. Earlier this week we were celebrating the 20th anniversary of some of the most important studies in embryonic stem cell research. So it's only been about 20 years that people have been thinking about these approaches with a therapeutic perspective. So I know sometimes 20 years seems like a long time, but in the world of science, it's actually not that long. So it's amazing how much progress we've made. So with that as the background, I'm going to jump into the story about gene therapies for blind and eye diseases. So you can find this on our website. We took quite a bit of time to put this story together. So maybe, Janelle, maybe we can provide a link to the story in the comments, because what we've done in the story is we've created a chart, and the chart actually has 3 different columns. One column provides a list of all kinds of different inherited retinal eye diseases, like Leber congenital amaurosis, X-linked retinoschisis, the list continues. The second column is gives you information about what trials are happening. And the third column gives the specific examples of trials that are welcoming Canadian participants to join the trial. So a lot of the questions that were coming in, we're asking questions like, I have all my questions written down here. I see Adina just sent in a question. When do you think there'll be a treatment for RP? Adina, we know it can't come fast enough, but there is actually an RP gene therapy clinical trial that I'm going to talk a little bit more about. It's an X-linked RP trial. So let me just go into a little bit of an overview of some of the trials that specifically are accepting Canadian patients. So that's a question that Theory, she sent in this question saying, are there any options for gene or stem cell therapies available in Canada? So this was really one of the big motivations for writing this resource, putting this together. We wanted to show you that although there's not a gene therapy trial that's currently recruiting patients at a Canadian center, there used to be one. This was a trial for choroideremia. It was led by Dr. Ian McDonald in Edmonton, Alberta. It's not recruiting, they're just wrapping up that trial right now. There are a number of trials that are, although the sites where you need to be treated are in the United States, I'm pointing at sort of obviously south of us, it's still really cold here in Canada. There are options for Canadians to travel down to the United States, have the intervention, the gene therapy, and then in some cases even be monitored in Canada. So, not in all cases though, but the few trials that I really want to highlight today, because these are trials that AGTC are involved with, and this is Jill who's joining us online. One is a trial for X-linked retinoschisis. So I don't know, is there anybody online with X-linked retinoschisis? Sometimes it gets called juvenile retinoschisis. This is a trial that is welcoming Canadian patients, and we're particularly excited about it because here at the Foundation Fighting Blindness, we funded some of the earlier laboratory work. This is the work that was done at the University of British Columbia by Dr. Bob Molday. Actually, Bob Molday is the doctor that's on our website. His headshot's there at the top. I think he used to be on our Facebook page too. So there's a trial for X-linked retinoschisis that's welcoming Canadian patients. And this is the thing about gene therapy, as I was saying, it's not just for anybody who has X-linked retinoschisis. If you want to determine if there's a gene therapy that's going to work for you, you need to know exactly which gene has a mutation in it. And sometimes it helps to know as much about that mutation as you can. So for the X-linked retinoschisis trial, they're looking for people who have mutations in the RS1 gene. So again, all of this information is on our website here, and Janelle's going to post the information. So the next trial that is welcoming Canadian patients, there's actually 2 different trials for the blinding eye disease of chromatopsia. So this is a disease that affects the cone photoreceptors. Always have to stop myself from just going down the rabbit hole of so much biology, but it's, the cone photoreceptors are those cells that are really light sensitive and important for high acuity light vision. So people with the chromatopsia have all kinds of troubles with high sensitivity to light, loss of color discrimination, and AGTC is running 2 different gene therapy trials, one for CNGA3 and one for CNGB3. So I know I've seen some people with the chromatopsia joining our Facebook Live sessions before. I'm not sure if there's anyone on there today, but I encourage you to reach out to me. I can talk to you more, or again, Jill's online today. So another gene therapy trial, and this is the one I wanted to spend a little bit more time talking about. This is the X-linked retinitis pigmentosa trial, because we know that retinitis pigmentosa is it's a rare disease, but it affects so many people, it's almost not rare. It's like 1 in 5,000 people, between 1 in 3,500 and 1 in 5,000. So there are a lot of people who are living with RP right now. We always get lots and lots of questions that come in asking, is there anything for RP? When will there be something for RP? We had tons of questions come in about that. And so I wanted to spend a few minutes kind of talking about this X-linked RP trial because this is one of the more common forms of retinitis pigmentosa. And what everybody who's listening should realize is that if you have one of these inherited retinal diseases, you really should be advocating, doing your best to get genetic testing done, because it's once you know what gene is mutated that you'll be able to figure out what gene therapies might you be eligible to participate in. Will different stem cell therapies work for you? All these questions, the more knowledge that you know about your disease, the better you'll be able to answer those questions. So Dave was asking about RP, Sofa was asking about RP, Sahad was asking about RP, Omar was asking, lots of people sending in about RP. And so with this X-linked RP, it's for a specific gene. It's for the gene RPGR. And so if you have that diagnosis, then this is a trial that might be good for you. And we're really happy to be welcomed into this trial in Canada because, of course, we care so much about our local Canadian patients. So this is fantastic. The last trial, I guess that is the last trial that I want to highlight. There's another one actually that is kind of on the radar, although not actively recruiting, and this is a choroideremia trial. So I don't know if anybody's online who's living with choroideremia. If you are, say hi. But there is a natural history study for choroideremia, and I wanted to take a few minutes to talk about natural history studies because these are incredibly important studies. If anybody online has a chance to participate, I encourage you to do so because these are the types of studies that lay the groundwork for the future of all kinds of different therapies. Because what a natural history study does is it tells what happens naturally to a disease over time. So this is really important to know, because how can you tell if a therapy is working? How can you tell if a gene therapy is working? How can you tell if a stem cell therapy is working? Well, you can tell because you know what would happen naturally if you didn't give any treatments at all. So that's sort of the motivation behind doing these natural history studies. There's a few different studies that are recruiting natural history participants, and I'll be sharing more about that later, but I encourage you to look into those studies whenever you have a chance. So with that, I did have some other questions that I wanted to address about the gene therapy story, but I wanted to put it out to our audience. I don't know if there's any questions that are coming in. I have, oh, sorry, I do have a question here. One question came in asking if there were any options in Canada for gene or stem cell therapies for people with LCA. So LCA is one of these inherited retinal diseases called Leber's congenital amaurosis. I do know that there is a trial that might be welcoming Canadian patients. It's not happening in Canada, but it is welcoming Canadian patients. I can post some details about it in the comments. And it's for LCA10. So this is a specific form of LCA, and it affects a very specific mutation. So I can post some details about that. And there is another LCA RPE65 trial. So this is interesting. There is, the new gene therapy that's been approved, Luxturna. This is what we've been talking about a bit. There is an approved treatment, but we're always developing new treatments, right? Even when you have a new treatment, unless that treatment is a total cure and absolutely perfect, we're never done our work. We keep wanting to develop better and better treatments. So there is an ongoing trial for LCA for the RPE65 gene, and I believe that that trial will soon be welcoming Canadian patients as well. So please stay tuned. And as for Stargardt's disease, I see another question from Berndy coming in. Let me finish talking about Stargardt's disease. I have a few emails out asking if there are trials that are welcoming Canadian patients into their Stargardt's trial. There's a few Stargardt's gene therapy trials that were initiated a number of years ago, and I have not yet been able to get a confirmation about whether they're accepting Canadian patients. So I hope to have an answer for you soon. Berndy is asking about rod-cone dystrophy. Again, Berndy, I don't have a specific trial for rod-cone dystrophy to talk about right now, but this is another recommendation that I hope everybody will take with them. A good way to sort of stay up to date is to look on a website called clinicaltrials.gov. So maybe Janelle can put a link. And I say this as a starting point. You don't want to finish your search at clinicaltrials.gov, but it's a good place to start and just see what's out there. Now, there's lots of good, excellent information on this website, and it can be a very good way to learn. So the AGTC trials that I was describing, there's very, very detailed information on the clinicaltrials.gov website about exactly what is required in these trials, how you could be eligible, exactly what's going to happen. But unfortunately, there's some not so good information on this website as well. And I don't know if some of you heard, last year there were a few women who had age-related macular degeneration, and they found about a trial on clinicaltrials.gov, and then they traveled to somewhere and they paid a lot of money and they ended up blind. So the two take-home messages is that when you're thinking about clinical trials, whether it's a gene therapy clinical trial or a stem cell clinical trial or any kind of clinical trial, you're a volunteer in that research, and your participation is absolutely essential for the future development of treatments. So you should not have to pay anything to be in trials, and you should be able to ask any kinds of questions that you want about the safety of the trial, what's going to happen, what's not going to happen. It's your right as a patient to ask all kinds of different questions. And that's what I wanted to highlight. Jill Dolgen, who is the head of patient advocacy. So it's really great to see positions like that at some of these new startup companies, because the role of a patient advocate is to be able to help sort of with all of those questions and to highlight that it's really about a patient volunteering their time to participate in absolutely essential and very, very important research. So I'm thinking a lot about clinical trials these days because I'm actually going to be at a conference for 2 days next week, hosted by Clinical Trials Ontario, and we know that the participation of patients in trials is just so important. And so we are thrilled to be in this time where there are more and more trials for Canadian patients, and I hope that this trend continues in the future.
I'll send you another.
Okay, there's another question coming in. So I wanted to thank Jill for being online. Maybe people are being shy, not asking Jill questions directly, but please know that she can tune in and answer any questions that might come up later. So,
Sorry.
Is there another question coming in, Janelle?
Yeah, sorry.
Before I switch topics, I was going to answer this last question. It is getting warm in here. It's hot in here, but it's cold outside. Grace is asking, are there different treatments for different gene mutations? Great question, Grace. And the answer is yes. So even, let's say if you get a diagnosis of retinitis pigmentosa, this is a good example because we know that there are, I'm always forgetting the latest count, but there's probably like around between 40 and maybe like between 40 and 60. They're discovering new genes every day, it's great, that are involved with causing retinitis pigmentosa. So in theory, you could have 60 different gene-specific treatments because, again, getting back to what I was chatting about earlier, if you're going to use a gene therapy to treat a disease, the way that treatment works is you take a functioning copy of the gene, like you make it in the lab, and then you put it in the cells that need this gene. So you put it in the cells when the gene is not working well. So that's why it's really important to know what your gene is, know your gene, because that's how you will know if a gene therapy might work for you. So the answer absolutely is yes. And again, I encourage you to go and look at this long list. I think that there were about 20 different trials that we listed, and those are just the ones that we were confident kind of highlighting in this review resource, but I'm sure I know there are more on the way. So there's at least 20 different gene therapy trials that are happening right now. So thanks for that question, Grace. So now shifting, and thank you, Jill, for joining us online. And so now I'm going to sort of finish talking about gene therapies, and I'm going to shift to talk about this very, very popular story that's getting a lot of excitement around the world. And this story, we wrote about it on our website, and the story is called Experimental Stem Cell Treatment for Macular Degeneration Restores Vision. So there was a big story in the BBC about this, and lots of different news outlets around the world. And I printed out the Nature Biotechnology paper. So just to remind everybody that the reason why the news broke on March 19th or March 20th is because that's the day that this paper was published. So that's sort of like the way science works. Like when you discover something and you're like, oh, I've discovered something and it's new and it's great and I can trust it. And the way that you can, sort of show that that really is trustworthy, good information, excellent new knowledge, is that you submit to a journal, a scientific journal, where it will get peer reviewed. Like other people who are experts in the field will read it and be like, yeah, this really checks out, this looks good, I trust it. And so it's nice that this was published in a very well-respected journal called Nature Biotechnology. And it was published on March 19th. So that's why all of the press came out afterwards. And the full title of that paper is phase 1 clinical study of an embryonic stem cell derived retinal pigment epithelium patch in age-related macular degeneration. So that's a mouthful. But there's a couple important words in that title that I wanted to point out. One is phase 1, 2 is retinal pigmented epithelium patch, and 3 is age-related macular degeneration. So the reason why I highlight those 3 different words in the paper is that those are kind of 3 big things that we need to kind of remember when we get super excited about the story. And I am super excited about this story because it's a great development, it's a great journal, it's a wonderful contribution to the field, and it's certainly going to move us forward. And so what this study was all about is that it was a phase 1 study. That means it's really early days. It's like you're just moving it out of the lab and testing it on people. And in that first phase, you're just looking at, is this safe? And maybe does it work a little bit? And so the really tremendous thing about this paper is that even though they only did this sort of transplantation on 2 people, both of the people had quite positive results, and they could not see before the trial, and they regained their vision afterwards. And so we've had tons of people writing in and saying, will it work for RP? Will it work for Stargardt's? When will it work for me? There was a really funny comment. Someone from New Zealand said that he was about to hop on a plane, and don't hop on the plane yet. I think, isn't it warmer in New Zealand right now? I think so. But we're getting there. And this was for the disease age-related macular degeneration. And what they were transplanting, they used stem cells to create a type of cell called retinal pigment epithelial cells. Now, these are the cells that kind of provide support and nourishment to the photoreceptor cells in your eye, and it's the photoreceptor cells that are light sensitive and are absolutely essential for vision. So when people say, so in age-related macular degeneration, often it's something happens with the RPE cells, and if you could get in there and replace and fix the RPE cells, then you can fix the photoreceptors before too much vision is lost. And incredibly, that's what they were able to do here. Really promising results. But would this same approach work to restore sight in somebody with retinitis pigmentosa? The answer is no, because in retinitis pigmentosa, the problem is not really with the retinal pigment epithelial cells, it's with the photoreceptor cells. So because we had so many questions coming in about, will this work for my disease or this disease, we actually posted a new story on our website, with maybe Janelle can provide the link to it, which is sort of, will this stem cell therapy work for me? And I hope that if you can take the time and read through, it's kind of a long answer, but very detailed answer, and I hope that you find it really helpful. And if you do, let me know, and if not, we can update it and try to answer more of the questions that you still have. So in short, amazing progress, and I'm glad that we still are funding such great research because we're going in the right direction. And I don't want to say too much more about this paper because the good news is that I am not a bioengineer personally, but we have our very generous clinician scientist emerging leader, Dr. Brian Ballios, who also has a background in bioengineering, who's going to be talking about this paper in more depth with us during our next Facebook Live session. So make sure you tune in for that. So I have a question from Connie, and Connie is saying, I have RP and I was never told specifically what type of RP you have. How does one find out which type you have? Is that done through genetic testing? So Connie, that's a great question. And I know that there are so many people out there that have had a very similar experience to you. And that's because it's actually, Connie, it just shows how far we've come in terms of our knowledge about what it means to have retinitis pigmentosa and what this disease is. So the way that retinitis pigmentosa gets diagnosed, there are lots of different ways that you can examine what's happening in your eye. There's lots of different tests that you can do to measure your visual field and look at what's happening to your retinal cells, and that will allow your ophthalmologist, just by studying your eye, to make kind of a general diagnosis, like, oh, it looks like you probably have retinitis pigmentosa. So many people, there was a time when that was really all you could do. You could look at somebody's eye, you could learn about their family history, like if there were other people who had had similar kinds of vision loss in your family, because it is an inherited disease. And then that was it. That's where the diagnosis stopped. And what's happened over the past 10 years, and really dramatically over the past 5 years, the world of genetic testing has really changed. It's been transformed. So genetic testing, there used to be just a few genes that you could test for. A lot of people didn't get a positive result, and the first diseases where you could consistently get a really nice positive diagnosis were some of these diseases where there's really just 1 or 2 or 3 kinds of genes involved. So a really good example of that actually is X-linked retinoschisis. That's one of the inherited retinal diseases I was talking about earlier, where the majority of people who have a diagnosis of X-linked retinoschisis have it because they have a mutation in RS1 gene. And same with choroideremia. Most people with that diagnosis have a very specific mutation. And that's where RP is a little trickier, because there are so many different genes that are involved with RP. And if you have a recessive form of RP, meaning you have 2 different mutations, and those 2 different mutations kind of work together to cause the disease, that can be very challenging to diagnose. So we are actually, at the Foundation Fighting Blindness, we're funding a really cool research project at the Hospital for Sick Children. Thanks to our donors, we're funding a project by Dr. Elise On, who's trying to identify new disease-causing genes. So we're still identifying new genes. We're still learning about the genetics behind a variety of inherited retinal diseases. So what you should do, Connie, is go to your ophthalmologist. I'm not sure where you live, but it sort of depends on where you live. In Canada, you would go to your ophthalmologist, or even to your optometrist, sometimes can give this referral, and ask to be referred for genetic testing. And in Canada, this should be paid for by our healthcare system. That's the beauty of living in Canada, one of the beauties. And you just have to be a really good self-advocate for it. So we can also provide a link in the comments about how to get your genetic testing done. I think it's called Everything You Need to Know About Genetic Testing. And we're trying to create an updated version that offers people advice based on which province they live in, because we know there are some differences depending on where you live. We try to make everything as equal as we can, but we know that in Canada, healthcare is delivered provincially, province by province, so there are some differences across Canada. And I know that in Atlantic Canada, sometimes genetic testing for retinitis pigmentosa is not covered, but there should always be an option if you're willing to pay for it out of pocket, and it can cost anywhere between $1,000 and maybe $3,000. It's not prohibitive, it's not cheap, but it can give people a great peace of mind just to learn a little bit more about what disease they have. And John is sending in a comment saying, can I sign up for a trial for macular degeneration stem cell therapy? So, great question, John. And we have lots of people who are wondering, like, how do I sign up? How do I get involved with one of these trials? And, this is one of the reasons why we do what we do, right? We want to try to connect you to these opportunities. And so what we have is, we have something called a patient registry. Again, maybe we can provide some links in the comments to our patient registry, which is basically like it's a medical database where we keep track of people who are willing to become a part of this database that is really for inherited retinal diseases at this point. We have a list of all the different inherited retinal diseases on our website. And John, you're asking about macular degeneration. So we don't actually have a way to include people with age-related macular degeneration in the registry. We have juvenile macular degeneration, Stargardt's disease. But if you do have age-related macular degeneration and you would be interested to participate in clinical trials, you can just maybe send us an email to the info account and we'll flag that, because we try to keep all the different trials on our radar. And although many of the people who we know are really interested in trials and really eager to participate in research, we want to help to connect you to those opportunities, because not all of these stem cell trials are created equal. So I just want to, so John, just be careful, because there's so much excitement and hype about stem cells, you have to remember that there's actually not that many legitimate trials. So if we're going to have a follow-up story about stem cell trials, I hope that you'll check out the story on our website, and maybe we had a story last year to help people kind of watch out for these bogus treatments where you could risk losing your vision. And I'll just reiterate that the thing you never want to do is pay money. I know there's one trial, it's the Scots trial, that I think it charges about $19,500 US. So just be careful. And with that, I mean, I had a lot of questions and I tried to summarize them, because a lot of the questions were just, will this work for my disease? And without knowing a lot more about exactly what disease you have, it's really hard to give a specific answer. And that really is why, one of the reasons why I wrote this story that provides a lot of detailed information that you can kind of hopefully come to an answer based on what you know about your disease, how advanced it is, what your genetic diagnosis is. There's all kinds of different factors that you should be considering. And then one other question actually I did want to address came in from Rosa. And Rosa was asking, when will this be available? So that's sort of maybe the last question that I'll leave everybody with. And it's hard to give a firm answer on that. And it's just, the more people that can get involved, the more people that can be engaged with us and participate in research and get involved, sort of, we know that is going to help to speed things up. But there are many different phases that you have to go through. The clinical trial phase is there's sort of 3 or 4 different phases, and then you have to have things go through different regulatory checks and balances, and then depending on what country you live in, they have to be kind of brought into your healthcare system depending on where you live. So with that, Rosa and everybody else, thank you so much for tuning in. I love a chance to answer your questions, and I hope to see you again soon. If you like this session and you learned something, please like it and share it, and I hope to see you again soon. Bye-bye.